voice. And so we'll look in front of you. You can bring your ear to your shoulder. Okay, good. And we want the head to go halfway to the shoulder and to the other side. Good. And looking for symmetry as well and any pains that they might experience. And then I'd like you to look over your shoulder as far as you can. Good. And then to the other side. Okay, good. And so we're looking for what visual cue on rotation? Exactly. Yeah, so chin over the anterior part of the shoulder. So that's our visualization. Nice and easy, and you'll get used to estimating in degrees. Yes.
Yeah, I think they do like recruitment, like coming like this. Like, do you stop it from happening? Do you how do you gauge that?
So yeah, so I would encourage them, like point that out to them. Oh, you're actually bringing your shoulder up, and encourage them to keep their shoulder down. And if they continue to do it, then you'll make a note that they're sort of pulling that in. Yeah. So do point that out because people will not be aware. That's a good question. Excellent question. And then for our inclinometer method, we'll be using 2 inclinometers. And so for flexion extension, you'll be standing beside them, and you'll put the one on top of their head. And you want to, on the ones that are truly medical, you can actually move the dial so that you can put the 0 at the bottom. With these ones, you don't put the numbers won't move, so you can move this to be wherever 0 actually is, so if you need to for your starting point. So for example, let me have you just lift your chin just a little bit. So depending on how their head is shaped, you may start at a different position. So like on her, it's actually starting at 10 instead of at 0. And then putting one on T1 and then keeping them in place as they flex and extend. So go ahead and flex again. Good. And then you would subtract any number that you get from the thoracic number from the cervical. And come back up. And then on extension, it's a little tricky with these because they're a little big, so you sort of have to put it off to the side more so that they don't run into it. And then extend. And again, subtract any movement. For lateral bending, you need to stand behind them so that you can put the inclinometer against the T1 spinal process. So it'll just be straight up and down on their back. This one will be on their head, and have them making sure that this stays straight up and down, and then go ahead and bend your head to the right. So staying with them. Okay, good. And build up. Okay, good. And she has full range of motion in both directions. And then how are we going to accommodate for rotation?
Have them be prone.
Exactly. So we're going to have them on the line side, and so I'll have you lie on your back.
Turn your head right.
Yeah, so your head up this way. And so this is good. So you want them to be a little bit past the edge of the table so that this doesn't run into the table. Yeah, just like, there you go. Perfect. And then holding with their head, starting at 0, and then slowly rotate to the right. And then make sure to go with them. Okay, and then to the left. Okay, good. Right, and so it's important to let them know that to go slowly, because if they go too fast, then you're going to miss keeping up with the inclinometer. Okay, you can sit back up. Thank you. Any questions about range of motion or inclinometer method?
So you subtract the thoracic from the cervical when you're doing flexion extension.
Exactly. And for
lateral flexion. Okay.
As well. Yeah. Okay, so we'll give you some time, pair up with each other, check both visualization, noting the visual cues, and then also test with the inclinometers. And remembering that they should be always considered in 5-degree increments. So especially when you're visualizing, you never want to write down that you were visualizing and they had 43 degrees of motion, because that immediately